This is a CBS 4 News special report.
We're taking you out live to a virtual news conference with Miami Mayor Francis Suarez. Let's join in and listen.
Plan will be implemented only when 3 specific criteria are met. The first is that there's a downward trajectory in symptoms, influenza-like symptoms, and a downward trajectory in COVID-like syndromic cases. Secondly, that there's a downward 14-day downward trajectory of actual new cases. And thirdly, that in terms of hospitals, that we are able to treat all patients without crisis care, and that there's potentially a robust testing program in place for all at-risk healthcare workers. We are working with the Department of Health. This plan has been prepared in conjunction with the federal government's plan, the CDC's input, FEMA's input, also the Department of Health. I spoke today to the Surgeon General, and we will be having a call later this week to walk through some of the data as they see it. They are obviously the gatekeepers when it comes to data compilation, and they're also the experts when it comes to epidemiologists on staff. We as a city obviously don't have epidemiologists. We've relied in part on external experts like Dr. Marty, who from FIU, who is an infectious disease specialist who has helped us, particularly on the front end of this. But we are going to be cautious in this process. There is, one of the questions that we've received up to this announcement is, where are we in terms of, in comparison with the county? It looks like the county, has sort of jumped ahead with these 4 task forces before there's a full analysis of phase 1. And so they may be opening certain aspects that we will not yet have open by the time that they open them. For example, they're likely to be opening this week golf courses, marinas, and parks. While those would all be open under our phase 1, we are not certain that we'll be at phase 1 at the time that the county opens them. So marinas and parks in particular may remain closed even though the county has opened them. We are obviously, one of the concerns is, policing, and we want to look through the county's plan, which was put out in the media today. Some of the requirements are going to be, I think, complex to patrol, but they've decided they're going to hire multiple hundreds of people to patrol their parks, and that's something that we're going to have to look at in terms of costs and reimbursements, et cetera. Once and if the Department of Health either certifies or allows us to certify that we are at phase 1, some of the things that we are considering is lifting the curfew. That's something that we've debated internally, and I want to give Commissioner Diaz-La Portilla, who couldn't make it on this call, a credit. He's been the one that pushed for us to implement the curfew, and he's also pushing for us to be very conservative on lifting the curfew. So we are considering it in phase 1, but that is not a final decision. We also are considering lifting the shelter in place, except for vulnerable individuals, in phase 1 as well, but that also is a subject of still some more internal debate. We would be opening under phase 1 our parks, our beach, which is Virginia Key, and marinas with strict adherence of social distancing of 6 feet or more. Obviously, if we see that in one of these openings, people are not observing the social distancing, then obviously we have the right to scale back that opening. Understanding that I fully support Mayor Gelber's closing of Miami Beach, and it's something that I've discussed with him, because I think Miami Beach is very different. It gets a tremendous amount of tourists, and has a lot more volume of people. Businesses or establishments would not be able to operate with an occupancy load that's greater than 25%. And even in that occupancy load, you have to restrict the distancing to 6 feet or more. So the social distancing will remain in all the buildings or in all the businesses that are open. Alcohol service establishments of any kind will remain closed in phase 1. Casinos, card rooms, frontons, racetracks, pari-mutuels will also remain closed. And restaurants and food deliveries will still only be able to deliver and carry out food, so they will remain in their current status right now. In all phases, we're still going to be requiring that people, and of course, urging people to wash their hands, use sanitizers, avoid face touching, sneezing or coughing into a tissue or inside of the elbow, disinfecting frequently used items, using face coverings in public, particularly when using public transportation, and staying home if they're sick and contacting their doctor. Unless and until we have a vaccine, we need to respect this new normal. If and when we're in phase one and we have experienced again another 14-day reduction or trajectory of reduction in influenza-like cases, whether they're new cases or symptoms that have been reported, and our hospitalization census remains stable, then we will consider going into phase two. In phase two, no business or establishment may be able to operate with an occupancy load that exceeds 50% of the business or establishment's total occupancy. No businesses can have more than 250 people at a time. Restaurants can begin to operate with restrictions. And here I'd like to commend Commissioner Carollo, who has had a thoughtful conversation with me about what those restrictions would look at, potentially, thermometers at the door, employees using face coverings and gloves. Obviously, the restrictions internally can get complex. Does a family have to sit 6 feet apart? Do people who are not, if they come from a business or if they come from a workplace, how do they have to sit? So those are requirements that we're going to work through as we implement the executive orders that implement this strategic plan. Movie theaters, live performances, venues, arcades, and bowling alleys may open with social distancing norms observed, and vulnerable individuals should continue to shelter in place in phase two. And obviously, we will maintain the strict adherence of social distancing throughout this time. In phase three, again, after we've received another 14 days of certification from our Department of Health that we are diminishing in new cases, the hospitalization is stable, and the influenza-like cases are diminishing, then vulnerable individuals will be able to, on a limited basis, resume public interactions, but should continue to practice social distancing. Alcohol service establishments that do not serve food may open with diminishing standing room occupancy, and gyms and fitness centers may open respecting social distance and sanitation protocols. All individuals should consider minimizing the time spent in crowded environments. Allowable occupancy loads for all business and establishments may at least what appears to be no less than a 6-week time horizon, and most likely to be a 7 or 8 week time horizon, if not more. I've basically articulated what are going to be the standing orders, and obviously, if as I've said before, if we start to see a regression, if people are not respecting the rules, then obviously we will not hesitate to start re-restricting. And that's one of the things that we want to avoid. I think one of the reasons why we want to be so careful and why this plan has been so carefully crafted, taking into account what has been promulgated by the federal government and the state governments and even the county, is we want to make sure that what we do is done with a tremendous amount of diligence and care. I'll say it now in Spanish, and then we'll go, I guess, to the commissioners, right, Stephanie? Okay. Gracias. Aquí estamos anunciando lo que es el
City of Miami Mayor Francis Suarez laying out the potential plan to reopen things in the city of Miami, not quite up to the county, where Miami-Dade County will be opening up some outside venues this week. City of Miami, a little bit behind that. Stay with CBS 4 News for the latest on the coronavirus.